Today is Tuesday, May the 12th, and you are here for the Kent County Board of Commissioners Policy and Operations Committee. I will call this meeting to order. The first item on our agenda is public comment. If you can please limit your comments to no more than 3 minutes and state your name and address. D, welcome.
Super excited. I wish I was at the Senate Banking Committee on Thursday, but I'll take the Kent County Policy Committee. Just because the markup for the Clarity Act, as y'all know, I'm a huge advocate for digital assets and cryptocurrency, and that's one thing that I believe that I definitely align with the Republicans on is financial freedom with digital assets. And some of the Democrats on digital assets and financial clarity, and actually being sure that we give banking access to everyone, because there are billions of people that don't have banking access across the globe because of the financial system, the Federal Reserve banking system, created in 1913. Rockefellers, the Rothschilds. And so just being able to have financial clarity around digital assets, and then also having a conversation. I'm no J.D. Vance or anything like that, but I did have a conversation with a 3D printing construction company in Ohio. You have a handout right here. And this handout, I didn't have enough because I actually spoke to the school board and I passed some of it out yesterday, but I did have some in a backpack. But it is a 3D printing construction company that has developed credentialed high school credit curricula for students to learn 3D printing construction and actually get high school credits for graduation. So I'll read some of this stuff. K through 12 seeking early career paths, incumbent workers seeking skilled upgrades, justice involved individuals re-entering the workforce recovery, community members, displaced workers from declined industries, what participants earn, industry recognized credentials, IRCs, pre-apprenticeship certifications, high school graduation credits, direct employment pipeline, revenue sources, school district and workforce board contracts, state and federal workforce funding, and tuition and employee training agreements. So I already gave this to our local school board here at GRPS, and I'd love to expand this across the United States, across our state, across Kent County, across the entire state of the global United States, the United Nations, everywhere I could, if I can pass this along to just be sure that students can learn 3D printing construction and help build infrastructure. I also like to give a shout out to Dan Burrow, because I passed along a signature sheet, and also Al Vandenberg and Commissioner Bujak. And Ben Green. I passed along some signature sheets for the Stockton Community Hub, and as you guys probably seen, we were selected to actually purchase the school from our local school district. So the vision of actually creating digital equity, digital finance, 3D printed housing, I actually have attained the white paper and been helping anti-sunset and esports programs and adding 3D printed construction utility and stream to earn activity base. So I'm super happy that this digital asset legislation is going to be passed. Thank you.
Great, thank you, Dee. Is there anyone else that would like to address the committee? Seeing no one, I will close this portion of our meeting. Next item on our agenda is special order of business. This is the Ready by 5 annual report. Jennifer Headley Nordman is the president. Commissioners, just a reminder, we're going to try to keep this 10 minutes. We have some questions. We do have a 9:30 meeting after this, so just try to keep your comments short and to the point if we can today. Thank you.
Good morning,
Welcome.
Commissioners. Good morning. I'm Jennifer Headley Nordman. I'm the very proud president of First Steps Kent. I am going to pass the presentation over to our two rock stars, Kiana and Jasper, in just a moment, that will go through the last year. Just wanted to take this opportunity to say thank you for believing in us to be able to do this very important work and believing in our families and our children locally. And so with that, we'll pass things over.
All right, good morning. We'll do a quick introduction and then we'll get started so you don't have to hear about our names again. I'm Kiana. I'm the Vice President of Community Investments, one of the fiduciaries of the Early Childhood Millage.
Hi there, I'm Jasper Tinoco, the data specialist.
All right, we will get us started. Oh, maybe if I can find the mouse.
There we go.
All right. Early benefits, early childhood, more specifically 0 to 5, is the period when development is fastest and when public investment can have the most impact. So the earlier we invest, the greater return that we have. What you see here on the screen is called the Heckman curve, and it shows that investments made during the earliest years have the highest payoff compared with interventions made at a later point in time. And it reinforces why community support for investment in early childhood and families is so important, because access to high-quality early interventions have shown to improve education, earnings, and health later in life. So it is both a child well-being and long-term community cost savings strategy. In the short term, it can improve cognitive development, reduce school absenteeism, and lower risk factors that affect health and development. And if early childhood investment can shape all of those, then this is also a long-term community investment conversation. And that brings us to why this matters so much for Kent County. For us as community members, it's invaluable because it means we're not only helping families meet their needs today, but we're also shaping a child's life trajectory later in life. And research tells us, again, that those first 5 years are really critical for their brain and skill development. And any barriers that are related to income, access, developmental concerns, trauma, and opportunity can really compound those childhood experiences. And what we're doing is reducing involvement in costly social systems later in life. Ready by 5 early childhood millage helps to make a more proactive investment across the community, across those first 5 years specifically. And we really want our children to be born healthy, thriving and developmentally on track, and connected to high-quality early learning opportunities with other supports that help families thrive. And that's what this millage represents. It's a community commitment to giving children the strongest possible start, because that investment strengthens families and our community as a whole. What I'd like to do is look through some of the services that are available. It is very small. I understand that it is teeny tiny, but that is just because we have a wealth of services. So we recognize that there is no one-size-fits-all approach to what the community needs, and that families have different types of supports that they need at different points in their life. And that this funding specifically allows that response to occur across a full spectrum. Through this investment, families can access a wide array of services that reflect a more completed early childhood system. And it's one that supports not only the child, but also the parent, caregiver, and family's overall ability to connect to the right resources at the right time. And that range of services that you see on the screen here is exemplary of the expertise that's within our community, all working towards shared outcomes for children and families in Kent County. What I'd like to do is pass it over to Jasper so he can give more of a data perspective for each of you.
All right, so I'm going to be providing a high-level overview of the calendar year 2025 performance, covering both participation numbers along with financials and other insights. So as Kiana already mentioned, Ready by 5 funds a wide range of programs across Kent County. So looking at the top chart, you can see here for calendar year 2025, participation breakdown by service category, with early learning nearly 12,000 individuals being served, followed by outreach and navigation at over 2,400. Parent education support reached nearly 1,600, and healthy development at just over 1,000. When we compare it to last year, what we see is a 7.5 year-over-year growth in individuals served, growing from 15,372 in 2024 to 16,528 in 2025. That means nearly 17,000 individuals reached across Kent County through these Ready by 5 funded programs. Now looking at the financial aspect of it, our utilization rate was outstanding. Nearly all service allotments were utilized at 98% utilization rate, meaning that 9.2 million of the 9.3 million awarded was reimbursed, reflecting just strong partnership and great stewardship towards public dollars. Now, when we look at the total services delivered, Ready by 5 programs delivered nearly 29,000 services across all service categories, reaching every zip code in Kent County. Taking a look here, this next slide shows what our external evaluators at Basis Policy Research conducted, a match comparison study examining predicted probability of kindergarten readiness among Ready by 5 participants entering kindergarten 2020 in fall of 2024. The question that they set out to ask and answer was, do children who receive academically focused Ready by 5 services show stronger kindergarten readiness than children who receive non-academic services? So using a multiple logistic regression model controlling for limited English proficiency, income level, race, and ethnicity, TS Gold intake score, and school and district fixed effects, they compared about 1,562 Ready by 5 participants against 3,321 matched non-participants. And what you see on the chart are two bars. In each pair, the first bar represents a similar children who did not receive Ready by 5 services, and the second bar represents children who did. For non-academic services, the left side of the chart, Ready by 5 participants showed a statistically significant lower predicted probability of kindergarten readiness at 36% compared to 41% for their matched peers. However, these findings do warrant context. Children receiving non-academic services often serve higher need populations facing greater barriers to academic readiness, and these services address outcomes that are not fully captured by kindergarten readiness assessments alone. For academic-focused services on the right side, the Ready by 5 participants showed a predicted probability of 56% compared to the 55% for matched peers, which is a positive directional finding suggesting alignment between service design and measured academic outcomes. Given with that, the data, we are working to integrate GSRP flags, so there is a possibility that some of these numbers could change when we redo the matching process, but based on the data that we currently have available to us, this is what we currently are seeing. Now, this next slide kind of adds one more layer to this. It shows how much services a child receives, so which we call dosage, and looking here at the academic services, comparing children who had 1 to 3 encounters versus those who had 4 or more encounters, disaggregating academic service participation by dosage reveals a really important finding here. Among children with 1 to 3 encounters, Ready by 5 participants showed a predicted probability of 61% compared to the 64% of matched peers. Among children with 4 or more encounters, however, Ready by 5 participants demonstrated a predicted probability of 53% compared to the 43% of matched peers. That's a 10 percentage point difference. What that means for Ready by 5 is that higher participation leads to better outcomes overall. While there is still a continued gap between the academic measurements and the services that are offered, Ready by 5 continues to monitor the data and in order to better align it with how academic services and participation overlap. Initial findings are overall positive, with positive indicators that we're heading in the right direction. But more is needed to really truly understand how these services are funded and compared to the academic-specific services. Now, moving forward, these 4 maps show where services are occurring across Kent County for the calendar year of 2025. Broken out by service category, the background shading represents the community type, which you can reference the legend on the lower left, which each circle represents service activity within a zip code, with larger circles indicating higher service volume. Before walking through each category, I really want to make note that each service category does distinctly different work, so volumes here really aren't comparable across maps. What really matters here is the reach. So early learning is a great example of that nuance. Over 1,100 playgroup sessions were held across 25 zip codes, but when we look at the families who actually attended and where they resided across all 31 zip codes, meaning that families traveled to access those services regardless of where sessions were held. And then when we look at other categories such as healthy development, it reached 28 zip codes. For outreach and navigation, reached nearly 30, and parent and education support reached about 29 zip codes. And what you can see here visually across all these 4 maps is that the largest circle clusters are within that urban and outer urban community, which align with the density of Ready by 5. And the lighter or the absence are continued to be observations for expansion, with those communities having a lot more room to grow. Taking a step back and putting it all together, once again, 30,000 services across Kent County just in that last year alone, knowing that each zip code was reached by every community type, and that just is a really clear and wide footprint collectively of all of our partners. I know I'm kind of running out of time here, but I'll just keep going. Sorry about that. I'll really try to make this quick. Now, looking at early learning specifically, once again, we see really strong performance across the board. On the financial side, early learning had about a 95% utilization rate, with about 835,000 reimbursed out of the 877 awarded. That reflects really strong financial stewardship. And when we look at the program impact, those numbers really are outstanding. Sessions grew by more than 14% over year. Total attendance grew by 17%, and the number of playgroup locations grew by 9%, meaning that not only more families were showing up, but programs are physically expanding their presence across the county. So in total, about 1,164 total group sessions were held, reaching about 1,528 total attendees across 165 unique locations, and serving about 2,200 unique children served. Now, it's worth pausing and noting that these early learning playgroups, what they really are, because behind these numbers are really intentional design models. Playgroups are led by bachelor early level childhood professionals who intentionally design activities aligned with Michigan's early childhood standards of quality and early learning literacy standards. Children engage in open-ended play, and that supports developments across all these domains. While the caregivers also receive a lot of individualized coaching, resources, and strategies to help support their child while they're at home. When we look at the engagement highlights, on average, there are roughly about 10 children per session, with each child attending an average of 5 sessions. That is really incredible engagement. And it's really just showing that these families are not just stopping in once, they're coming in continuously over and over again, repeatedly, which tells us these programs are really making a real, lasting, long-term effect with these families that are being served. Now, looking at the outreach and navigation numbers, this is where we see families and how they're connecting to the services across the county. In 2025, 13 agencies made nearly 6,500 referrals to the community resources. That is a 19% decrease from the previous year, and I want to acknowledge that directly. With shifts in federal priorities and the landscape around social services, we have noticed this trend, and it's something that we are paying really close attention to. There's recognition from community organizations that participants may be more reluctant to provide information as they receive services. This doesn't mean that families and children are not happy about services. Rather, they are more cautious about the information they share and decreasing their desire to participate. As a result, the number of individuals referred were also decreased by 7% from 2024. However, a really good important finding is that 78% of those referrals were confirmed completed, which actually grew from about 5% from the previous year. 78 is extremely strong follow-through rate, with only 9% confirmed as not completed, with the remaining about 13% having an unknown completion status, meaning that the completion rate could actually be higher than what's reflected here. So while volume is down, the follow-through rate is up. It's also worth acknowledging that the needs vary from across families. Some families require one single, referral, while other families are usually connected to multiple different services. But out of those nearly 3,000 individuals referred, they were connected to over 522 community partner organizations and partners across Kent County, reflecting just the depth and the nuance of just the community involvement. The Sankey diagram below shows the referral completion rate, which gives us a window into what the needs are the most. This is the most common referral categories were about family and caregiver support, early childhood education, and mental and physical needs, which specific services include home visiting, food access support, housing support among being the most frequently requested, and highlights the wraparound nature of what families need support in. With that, I'll pass it off to Kiana again.
I'd also like to note that all of the data that you see, we have one data person and you're looking at him, so. All right, I'll give you a quick synopsis of our community need and system response. What we're often seeing in community is that families need more than just a referral or a short-term connection. What we've heard from previous and current funded service providers in the community is that material goods or household items are a necessity for children to thrive in community. Often that is cribs, diapers, onesies, clothes, formula. It could be an array of things for children to have a healthy pregnancy or a safe birth. And the goal is not just for those things, but really a strong foundation for infant well-being in totality. To note, sometimes the most effective early childhood support is the most practical, and this is the most practical by providing and making sure that families have what they need so that children have a safe start in life. We do have some acknowledgements that do have to be made. There are some changes that are affecting our local service network. You see up here on the screen, Bethany Christian Services and HealthNet of West Michigan. Within the first quarter of our term, which is October 2025 to September 2026, Bethany Christian Services alerted us that their interpretation program would cease to operate. They would no longer be able to serve the community due to the federal actions that suspended refugee resettlements, and those were for a number of countries that primarily served a large amount of Kent County constituents, and that stagnated the amount of individuals that they were able to serve in general. Therefore, they had to shutter their program. In addition to that, in April of 2026, HealthNet of West Michigan, just last month, announced that they would be closing on May 22nd of this year, and that is also due to shifts in federal funding, government policy changes, and other external pressures that they could not navigate against. And I'd like to note that these closures are not due to Ready by 5, as we are a portion of their funding, but not all of it. But they do reflect a broader policy change and reductions in the funding environment as a whole, and that affects our local community-based providers. So what we're doing is we're working closely with our community partners to continue to preserve access, to not create gaps in services for families, but we want to make sure and maintain the essential services for children and families here in Kent County. And even as those external resources become more limited, we're getting really creative with how those dollars are spent, and making sure that children's needs are met broadly. We also have, as a closing, some service category updates and changes for you all. We did have previously 8 RFP types, and those have been reduced to 4 RFP types. We're just moving down to Born Healthy, Developmentally on Track, Early Learning, and Accessible Resources to simplify the overall structure, reduce some overlap, and again, make it easier for providers, reviewers, and partners to understand how services fit within that early childhood ecosystem. And the work itself is not shrinking, but rather the framework is just becoming more clear, more aligned, and easier to communicate. We appreciate the time that you took to hear us today, and we're welcome to answer any questions if you need.
Wonderful, nice job. Commissioners, Commissioner LeGrand.
Thank you, Chair. I have a question about your graphs about kindergarten readiness. And when you talk about academic readiness, and academic services and non-academic services, and I'm wondering, what does an academic service look like?
An academic service looks like access to an early literature environment. So they could be reading books in a play group. Again, most of the services that we do have are meeting those basic needs and foundational supports, but early literacy is in some way a part of the TS Gold system that we measure, but not all supports are measured in school academic outcomes, which makes our data findings even more difficult. So there are an array of things that we can consider early learning, but that would be a large data point for us to provide to you.
And does this mean that determining academic readiness, whether it's the kids that you serve or other kids who are not part of the program, are they looking at, academic indicators? Like, do they know letters or things that way back in the dawn of time when I went to kindergarten were not considered?
Hi, Commissioner LeGrand. I'd be happy to answer that question.
Yeah.
And so for those of you that aren't familiar with my background, I'm a nationally certified school psychologist. And so the kindergarten readiness assessments that we use locally are literacy-based. And so to your question, they look at things like, do you recognize letters? Do you recognize letter sounds? And so when we're looking at comparing our data that's collected through Ready by 5, if you're looking at early learning, it's much easier and much cleaner, right? If you're
Yes.
looking at literacy-based skills to literacy outcomes. And so, to your point, I think there's opportunities, right, to answer some more specific questions moving forward that can help us connect dots between the types of skills that families and babies are acquiring through something like healthy development as a baseline and then follow up. Opportunity, right, as we look at other assessments that are maybe having additional domains in terms of kindergarten readiness. But the ones specifically here are literacy only that the
Okay.
districts use.
Okay, that's very interesting. Okay, thank you very much.
Yeah.
All right, Commissioner Steck.
Thank you, Chair Burrow. Good morning. So I frequently hear that Kent County is the best place in the country to raise a family in. But having 6 kids, I've learned that being family has not really come natural to many people, including myself. And so what you do here, I think, is so critical in helping us get along on that goal. What percentage of your programming is income-based, or the recipient is required to have a certain income qualification?
So we do require that all of our service providers initiate a cost share model where they understand what income levels individuals are at in order for them to obtain services, and they would pay their fair share. However, most of the families that we're seeing are lower income and need their basic foundational needs met. Do you have additional context?
So do they have to be? So if a reasonably well-to-do community says, we'd like to have you come and do some educational programming here, would you do it?
Absolutely.
So my follow-up question is, and thank you for the data, by the way, because I've been one of the people that has always driven this program to say, we need to be analytical about what's the outcome, are we really making a difference? And I also understand that that's kind of hard to measure. I've read Heckman's stuff, but I'm intrigued by Elizabeth Gilhood is cited in one of the footnotes as doing another study. Can you make that available to us?
Absolutely. If anyone here knows me personally, you will know that I have a wealth of early childhood research that I could share a whole zip folder with you.
Well, starting with the article would be nice.
I won't overwhelm you immediately.
Yeah. The data that you're referencing, is that our own accumulated data? It's an assessment of data on our clients and the work that we've done?
So this data that we're referring to is our local data, but we do refer back to other research as well.
Okay, because I'm sure that there is similar analysis done elsewhere in the country, and it'd be nice to compare because as you say, we're sort of on the cusp of learning where these directions are
Yep.
going, and it would be helpful to see how does that fit into the experience of other communities and broader studies. So,
Absolutely.
thank you.
Yeah.
All right, Commissioner Hennessy.
I hadn't realized Bethany was dropping the translation services. Could you speak a little bit more in terms of where you're going to be going for that?
Yeah, so we do have additional translation and interpretation services. We spoke with the county and were directed to find other translation and interpretation services. One actually that the senior millage uses, we were referred to and have now taken on as a service partner. So Voices for Health is now initiating the translation and interpretation. They took over the remainder of funds that Bethany Christian Services had and have now implemented services for our partners. We also have an RFP that's open, a request for proposal, and we have 2 translation and interpretation services that will remain open, which would be Hispanic Center of West Michigan and Voices for Health, and both of them have applied for the upcoming contract term.
Commissioner DeBoer.
Thank you, Chair. So there's a lot of need in this area, and I think sometimes it can be hard to have a clear focus of what to spend resources on. So going forward, how do you foresee your vision? Like, will it be changing at all? Will it, like, I guess, what is the clear pathway that you foresee for First Steps Kent to be able to serve the community? Like, as far as, is there one need that's more overwhelming than others? Or are you going to continue to provide like an array of services?
So we'll continue to provide an array of services, but to add on, we are seeing an evolving landscape. And our job is to respond to families who, our job is to respond to families as they need something. So service providers tell us what they're hearing in family surveys and family satisfaction and feedback, and we take that and we listen to it and we respond appropriately, which is how we were able to understand that we needed to provide material goods to families because that was something that they previously didn't have before. And so now they will get material goods in the future to help support their foundational needs. But we do respond as needs change. So right now, there's not a specific need. It's just that we're responding to what families are needing currently.
Follow-up question. So response is good. I mean, I think it can fill needs. But do you foresee anything like proactively to try to help families not have as much need?
So that's the goal, is to meet the need before they get to the next step so that they can actually be successful when they get into school for the first time. So when we meet the need, we're curbing the response for other interventions. And the hope is that when we do this, they won't need those costly social system interventions later on in life, but they'll need the basic things, like maybe they need help paying for a textbook, but maybe they don't need the police to be involved in their household life.
Commissioner Faber.
Thank you. Thank you so much for all your work. My own lived experience is that I've raised kind of two sets of kids in this community. My oldest is 20 and my youngest is 10 months old. And so I've seen the difference really in our community raising kind of kids 15 years ago to today in terms of access, in terms of just referrals, how much more material is available. It's just so much clearer how a family can navigate services in our community thanks to Ready by 5. My daughter currently is at the Learning Lab at GRCC, and it is almost daily that I see a play and learn group in there, parents from all over the county that are accessing that, getting resources, getting the connections that they need. And so just from my own experience, thank you so much for the work. And I think it's a really, to Commissioner Steck's point, to me, it's really part of Kent County's brand. You know, connected to all those play and learn groups are the Ready by 5 logo, are that Kent County cares about your kid. And I think that's just really powerful if you are raising kids in this community, and a real tribute to Kent County's leadership.
Thank you.
We could hear you here. The live stream was struggling with the microphone, so I apologize for that. Commissioners, any other comments or questions? Board Chair Green.
Thank you, Chair Burrow. Thanks for the presentation. I just was looking at the service concentration maps, and I would like if you guys could expand a little bit upon how you're meeting the challenge of serving families and children in places that are not as densely populated. And I recognize it's a challenge because you know, this is a nice map, and I'm afraid to fall into the temptation is to say, well, there's rural areas that have smaller dots or no dots, but there's also fewer people that live in them. So I'm trying to be fair about that, but also recognize that you mentioned earlier that there's folks that a lot of the folks that utilize the Ready by 5 services are lower income, and I know there's a lot of rural poor that are included in some of these areas on here that I don't see a lot of, you know, map dots. So I just wanted to see if you could expand upon that and talk about how you're meeting that challenge out county.
Yeah, do you want to talk about our percentages for 5 and under?
We can. We could also talk about just how we're focusing with our providers.
Yeah.
You know, a lot of our providers are really trying to work hard in terms of reaching out to those areas, knowing that transportation density population is a lot lower. One of the difficult things is that we do share some of those outskirts ones are partial as well. So it happens a lot of the time where we are reaching services, yet once they find out if they're not within the zip code, that they don't really are necessarily eligible because they're part of a different, county in general. So long story, I think it's really working with our partners to see the opportunity for expansion and understanding the needs within each community. But a lot of it is, do you want to add on to it?
Yeah, we're also asking our service proposers who are completing proposals what zip codes that they're meeting. I don't know if I can highlight on here. I think I can draw a little bit. But what we're seeing here, and maybe some of you can see this is not a straight line. But this is about where Kent County cuts off. And what we're seeing is families will travel across that line but become ineligible for services because they are not a part of Kent County, which reduces the amount of individuals in that area per se who would like to participate in Ready by 5 services. But they are unfortunately not Kent County taxpayers. So we ask our service providers, where are you meeting in zip codes? We have that on proposal documentation. We ask all of their demographics. Additionally, Ready by 5 recognizes that these are areas where we are looking to expand, and we've all met with additional service providers who exist in those areas, and we're hopeful that they will complete their proposals on time so that we can potentially have them for our review board and we can expand services in those areas. And maybe you might see those dots be a little bit bigger to enhance the services that are available. Does that answer your question, Ben?
Yeah, that's helpful. Thank
Okay.
you.
All right, any other commissioners' comments or questions? All right, seeing none, again, really appreciate it, your passion for your job. I love having presenters and folks coming up here that love their jobs and do a great job presenting. So job well done. I appreciate it. I think we're touching more people on the board this year with going back to the 2 committees. And again, job well done. Thank you. Appreciate it.
Thanks, everyone.
All right, next item on our agenda, the Area Agency of Aging of Western Michigan Annual Report. Kendrick.
Good morning, everyone. Appreciate the opportunity to speak before you today. My name is Kendrick Heinlein. I'm the President and CEO at the Area Agency on Aging of Western Michigan. Want to focus on the data for 2025 and talk about the 2 paths we commonly see in aging and how that relates to Kent County. So before you today, we see a proactive path, aging at home, coordinated supports, stable caregivers, lower overall cost for services and service delivery. Reactive includes emergency room visits, crisis-driven care, emergency placement, and higher health costs for individuals. As representatives and commissioners of Kent County, I'd like to emphasize this proactive and reactive because you've chosen to, we pay for both regardless for what the paths are. But the path we fund through the Kent County Senior Millage is that proactive, prevention-based care. So you can see here the average cost for fall-related hospitalization is $30,000. The prevention services on average that we were providing in 2025, and this is consistent all the way through 2020, is between $200 to $500 for these preventative, proactive services, which I'm going to be touching on. Why is this important? So as the bigger picture, as we see, 1 in 5 Michiganders are currently 65 plus. This is on track to be 1 in 4 by 2030. What this looks like for infrastructure is a shortage of direct care workers, lack of facility space, and emergency rooms used as primary care facilities, which is what we try to look to prevent. What does that mean for a consumer that is eligible for the Kent County Senior Millage? So the senior loses that choice, cannot afford that care, which oftentimes results in a hospital stay and emergency placement. Caregiver burnout, because all of a sudden, I will say our services are focused on proactive, but we do not have the ability to be emergency 24/7 support in the event of those crises. So those caregivers experience that burnout trying to make sure the individual that they care for is getting their needs met, which then ultimately leaves the negative health outcomes for that older adult, which is a higher cost on the system and for everybody involved in that scenario. So as this proaction and the system that works through the Kent County Senior Millage, we have coordinated services that we're able to leverage through our 50-plus partner network, and that's also not including our My Choice Medicaid waiver and our Older Americans Act service delivery. We have that navigation, eligibility, and oversight, and we have those outcomes to be able to adapt how our services look over the 25 years that we've been providing these services throughout Kent County. The question was asked about, have we changed how this delivery started since 1999? And we have. We have focused much more now going back to our core services through a strategic planning process to adapt what are our core infrastructure services. So that looks like in-home support, meals, transportation, and that respite that we know is so key to caregivers. And then we have our other services such as legal, home repair services, adult day services, to where we look to wrap around that senior to make sure that that infrastructure is there when they need it. What does that break out to? So that breaks out to our daily living supports, in-home care, transportation, nutrition, dental care and vision, our health and safety, which is medication management, mobility equipment or assistive devices, home modifications, and then our caregiver supports, respite, education, support services, and then wellness and independence, which are our healthy aging programs and social connections, such as our senior centers and other social activities that we provide. How does this investment look? So we do have that locally controlled funding for our local needs. Being an area agency and one of 16 through the state of Michigan, we are able to see what are those local needs, not only in Kent County, but for the other 8 counties that we serve as well, but then throughout the state of Michigan to be proactive, but then also realize what is taking place in Kent County, what do we have the ability to focus on, what do we have the ability to leverage our great resource of partner networks and the resources in general, and look to fill those gaps that we see do happen from our federal and state programs. It also enables our flexible, responsible care. So because of our millage, we do have 1-year funded contracts with our partners. We go through a funding process on an annual basis, and that allows us to be proactive in the approaches that we take to be able to adapt our service delivery to make sure that we are meeting that need or starting the process of looking at how we can meet that need. Also like to highlight, we did reach our 40 out of 40 zip codes served, and for the individuals through 2025, I will highlight more what did that look like. So we had 19,979 unduplicated clients broken out by service. That was over 44 unique services. 41% of those services were for priority services. 32% of the individuals that received care lived alone. 33% were low income, and 10% were veterans. Also like to highlight the contribution portion, our cost share and program income of the $622,686. Those are invested directly back into the programs. So really basically if you are paying $1 for that ride and that transportation provider's budget was $10, it is now $11 because that service funding goes directly back into those programs to make sure that those individuals are able to expand, but then also sustain the services and the service delivery that is so important. The spending, we did spend at 98%, and that broke out to $15,626,600 for fiscal year 25. What this doesn't show, when we talk about these 2 roads, there is a growing demand which is outpacing our capacity. We do have rising cost of these essential needs we see for our meals programs, our home programs, our transportation programs. Those rising cost of service delivery is something definitely on our radar, and we are looking for creative solutions and sustainable solutions to how we can impact that. There's an increasing complexity of client needs, so the health complexities that we are seeing for our individuals being served through the Kent County Senior Millage, we are having more complex, whether it's behavioral health, acuity needs, housing needs. The individuals are needing that support, and we are seeing more of those individuals needing that higher level of intensity and complexity for the clients receiving service. We do have wait lists for our programs. So as I'm talking to you today, we do have wait lists for our programs, whether it's for our in-home care or other underserved services that is growing the demand for the individuals looking to access that specifically in Kent County. And we do have workforce shortages, which we are looking specifically for the direct care workers. That is a national issue that we are seeing throughout the United States, but specifically in Michigan, we are roughly about 11,000 caregivers short for what we are looking for that in-home care aspect. So we are focusing on different items. How can we be, move the needle as far, and that has come to as far as wages, education, giving these individuals, whether it's graduating from high school, the opportunity to experience what that care looks like, but then also the recognition and respect that those individuals they deserve, quite honestly, for what they are doing. Want to highlight the connecting the data. So this is a story we had about an individual specifically through our caregivers. It was a story from Rick. He lived with his wife, Gail, was the primary caregiver. So taking care of Rick in that situation was consumed the lives of those individuals. We were able to get Rick connected to our service specifically through the Adult Day program, where he spends 3 days each week, where he receives meals, spends time outdoors, and is able to socialize with others, which allows Gail to meet those necessities that as caregivers we so often put on the back burner, and has improved their quality of life. Want to highlight the oversight and accountability, so that comes through our Kent County Senior Millage Review Committee, which makes those annual decisions for where the funding goes and what that funding looks like for our partner network. Local residents, this is made up of local residents and county commissioners, and then also is supported through the staff at the Area Agency on Aging of Western Michigan. As I touched on earlier, we were 98% spent of the funds to make sure that we collect that information on a monthly basis, and only are those partners reimbursed after those services are provided. On the path forward, we look at, we appreciate our longevity, our impact of our 5-year average. We serve on average 21,661 individuals through this millage. For every $3, it is cost effective. So for that process, we have over 50 partners, over 44 unique services, and still looking to grow that, but also looking to where do we need to prioritize those services in the coming years as we see some of the funding landscapes change, but also some of the needs changing of the older adults receiving that service. I hit my 10-minute mark there. I would be happy to entertain any questions.
That was fantastic, right on the dot. Commissioner Bujak.
Thank you, Chair Burrow. Just a quick question. Is 100% of your funding come from the millage, senior millage, or do you have other sources of income?
So we have many other sources. So we receive Kent County Senior Millage dollars. We receive Older Americans Act dollars, which are federal and state dollars. We receive My Choice Medicaid waiver dollars, and then other grants and special items. So as you see here, our overall budget is around $67 million. $15 million of that is coming from the Kent County Senior Millage.
Okay, thank you.
Yep.
Commissioner LaGrant.
Thank you, Chair. I wonder if you can just go into a little bit more detail about those wait lists that you were talking about which service areas they cover, and about how long are they, like how long are seniors having to wait for some of these services?
Yeah, absolutely. So I will touch on our care management program, which is our highest level when we look at the acuity of the clients, is currently at about a 1.5-month wait list for the services and the needs there. We are seeing about a week wait list growing for our meals programs, and then our underserved. So what that is it's not technically a wait list, but it's those individuals not receiving that service for services like transportation or outreach and assistance. That is growing on average. We have about 353 individuals a month not getting a ride or not getting that service that they need on a monthly basis.
Wow. Okay, thank you.
Yep.
You did get Commissioner Steck here today, though, so we do appreciate that.
What was that?
I said you did get Commissioner Steck here today, so we do appreciate that.
Not hearing that was bad timing.
I have a question.
That's Commissioner Steck.
Yes.
I haven't had my mic on the whole time, just getting ready. Good morning, Kendrick. Good to have you. Great to have the report on this service. I wanted to ask a couple of things because until I get cut off, the concept globally is seniors tend to either go into an institutional structure or they try to sustain themselves in their home.
Yeah.
And this programming is principally driven to try to support them in that decision to stay at home and age there. And we know it costs a lot more to go into the institutional structure. We also know that when they do, that usually results in Medicaid kicking in, covering a good part of that cost. So from the society's point of view, we spend a lot less money keeping them in their homes than we do institutionalizing them. We also hear, though, that as seniors stay in their home longer and longer, they keep houses out of turnover, and therefore our millennials don't have homes that they can live in, and it just goes from there and there. Are those really the only two options there are? It is stay in home and keep the house out of circulation, or go into an institution? I said I would give them an easy one.
I was gonna say, you gave me an easy one there. I have a lot of thoughts on that, but for the time we have here today, I would say no, that's not the only option. And to look at, you know, when we are keeping those seniors in our home, there's also a part of the Kent County senior millage that goes in investing in the infrastructure of that home. So whether that's siding, roofs, home repairs, putting on a ramp, making it accessible, fixing walkways. I do believe there's a component of keeping that homes and that value and that structurally soundness of that home up for the next residents moving in that is beneficial. I'd say we have a long way to go about what intergenerational housing looks like. So as far as having one single family in a home, I think there's some adaptive and innovative ways that we could make sure that seniors are still getting that care through the aspects of intergenerational. And I would say some of the aspects of the senior communities, as far as assisted living or housing communities go, to where they are moving in with individuals, whether it's a 48 complex unit where they have that sense of community, they still have that autonomy, but for lack of a better term, are freeing that housing supply up for younger generations to buy, are all avenues that we need to be exploring more thoroughly in not only our region in Kent County, but throughout the state of Michigan. While not losing a focus on the key to a lot of that is that transportation accessibility and reducing that social isolation.
That's another presentation.
That's another presentation.
So, and it strikes me that everything that we read suggests that this economic stress that puts these dynamic choices before seniors is only going to get worse. I mean, if Social Security, in fact, is going to decline the way everybody predicts it is, you're going to see more and more individuals who are facing a very difficult choice in that. So where is that conversation taking place about building the third alternative that helps us get more of these global objectives done?
So it's taking place at the federal level. We're partners with US Aging, and what that does is it represents the 672 area agencies throughout the nation. And we're having conversations about best practices. So what are our regions, such as in Ohio, Indiana, Minnesota, doing to be able to make an impact on this and start the path forward for what does that rebalancing and that shift looks like. On the back end, we're working as a state, as area agencies, to put together a formal white paper on what a proposal 10-year plan would look like to really make an impact on this and not have a stopgap that is just going to meet the current need and not plan for the future. So I would say in the coming 6 to 9 months, you're going to see kind of what that will look like and what we will be proposing, not only at a federal level, but statewide level as well, to start moving in the direction of capturing what the lack of income is going to look like, capture that seniors are living longer, which is a great thing, and then capture what actually aging well looks like in that situation. And how can we be cognizant that that is one part of the system, and there are still first-time home buyers, there are middle generation that are needing these accesses to the supports, and how can we make sure we're not penalizing those abilities by just focusing on seniors specifically too.
Well, I'd encourage you to help us stay ahead of this curve at the local level, at the county level. When do we need to start rethinking some of our long-term programming maybe adjusting some of the things that we are doing, and maybe redesigning some of this before it's crisis level.
I would say the county, you started it in 2023 with the revision of the Kent County Senior Millage Strategic Plan. That was a good step to focus on what those priorities look like, focus on where is aging going in Kent County, and prepare partners for what those conversations look like from now, I would say, until we get to the next millage renewal coming up here in 2029 and 2030.
Okay, good. Thank you.
Yep. Minority Vice Chair Faber.
I'll just be brief. This is kind of my day. I've got an 84-year-old mom that we just navigated through a lot with, and I guess that's really my question is, you know, when you're in it as a son or daughter, helping your parent kind of go through this, it's like a crash course. You don't think about these things until something happens, and then all of a sudden you're, you know, Googling everything under the sun to figure out how to do what's best for your parent. And I would wonder if you could just speak briefly about sort of how are we reaching out to, you know, the folks that are in that kind of sandwich generation right now to really know what they need to be thinking about early enough so that, you know, hopefully they're better prepared. I'm like, you could teach a college course on, you know, what you should know about aging parents. But I was just, again, struck at how little information was sort of out there and how murky it is in terms of how you help someone go through that. So could you just speak to that quickly?
Yeah, absolutely. So it's something that we focus on in that education and quite honestly, how to navigate what those resources are. Over the past year, we've began heavily investing in options counseling. So what that looks like is for an individual to come and learn about the resources available, but then also put a plan in place for where they are right now, but what that looks like as they progress. We've seen that a lot with dementia diagnosis. We've seen that a lot with where do I need to move? And it puts together that plan. So even if you don't need it right now, that plan might start with a meal. It might start with nothing and you're not accessing it for another 3 years, but it takes the caregiver and the individual that they are providing that care for through that journey, lets them know how to access those services and hopefully provide some respite for when the time does come. Because as I said earlier, if we are in a full reactive mode, we've already lost, quite honestly. And so we want to start getting individuals to think about that aging journey and be able to have that options counseling visit, which can be provided virtually in home or over the phone for individuals and their caregivers to be able to go through.
Great, thanks. You know, and it occurs to me like something the county could even think about, maybe we do with our HR department, but it's like as people are even nearing retirement to help them know like early, like,
Yeah.
here's what you're gonna see. You may still be 20 years out, but just adding that into sort of the conversation, I think would be really helpful for people. Thanks.
Thank you.
Commissioner Hennessy.
Thank you for being here. I will shorten this up. We are, you know, rightfully focused on what we're doing here in Kent County, but you are a regional entity. I'd just like you to, you know, give us a short briefing on, you know, how you impact things regionally through all of the counties that you serve and the importance of the federal funding.
Absolutely. So yes, we do serve 9 counties throughout our region. We go as far south as Allegan, far east as Ionia, and as far north as Mason County. And with that, we impact that regional, what that service delivery and that operation looks like throughout the 9 counties is very different. We do have a needs assessment that we use. We do rely on our partners and data network to be able to look at what do those service parameters look like. Also, we leverage those older American Act dollars that are being referenced, which are federal and state dollars, in combination with the Kent County Senior Millage to make sure that we're able to stretch those resources and be able to get those individuals the care that they need. The complexities that an older adult is experiencing in Lake County looks different than what we see in Kent County. So how do we work with those local partners and those local entities and still shore up those resources is something that we are consistently doing through those surveys, data, and then leveraging what our partner network is telling us from whether it's at the federal or state or local level as well. Yep.
All right, Commissioner Steck.
Thank you. Just going to quickly, as a trailblazer in aging in place, I was going to share with my colleagues that you could go to ChatGPT and ask for an aging plan. You'll get something you can work with. Thank you.
I will highly, highly say not to do that, and please connect with our agency.
Any other commissioners, comments or questions? All right, Kendrick, thank you so much. We really appreciate it. Again, a couple nice reports today, and we appreciate everyone being here.
Thank you for your time.
Thank you. Next item on our agenda is the approval of last meeting's minutes. Do I have a motion, please? Motion by Commissioner DeBoer, supported by Commissioner Morris. Any comments, questions, changes? If not, all those in favor, please say yes.
Yes.
Yes. All those opposed? Last meeting's minutes have been approved. Commissioner comments? Any commissioner comments? Commissioner Steck?
Quickly, I went to the contractor's opening event at the amphitheater. Wow, it's spectacular. So look forward to seeing everyone there.
Fantastic. Any other commissioners' comments? All right, just a couple items to update. We will have our next meeting in May. We do have a couple action request items on that meeting. Probably not have that meeting on the 9th because it's only about 13 days later, not that far after that. Then we will have our last meeting in June, most likely. Stay tuned. We're not canceling that officially in June. We'll wait to see how things progress and if there's any action items. Seeing no other comments or questions, meeting is adjourned. Thank you so much.